Have you ever felt your hands or feet tingling out of nowhere? Have you had memory lapses even in calm moments, like forgetting where you left your keys or what you were about to do seconds ago? Or worse, do you feel so tired that even a good night's sleep doesn't help? Most people brush off these signs. They think it's just stress, aging, or the result of a busy routine. But what if I told you these seemingly harmless symptoms could be silent warnings of something far more serious? Something that, if not addressed in time, could cause permanent damage? In this video, I'll show you the 4 most serious symptoms of vitamin B12 deficiency. Symptoms often mistaken for aging or exhaustion. And by the end, I'll share the ideal vitamin B12 dosage according to the latest studies and explain why common multivitamins fall short. Stay with me until the end, because this information could literally transform your health. Hi, I'm Kenji Oshiro, and you're watching Global Health Guide. Here, we speak the truth, backed by science and what actually works. Subscribe now so you don't miss a thing. You'll be shocked by how many people live with vitamin B12 deficiency without even suspecting it. According to one of the leading references in endocrinology, about 40% of the global population has some degree of B12 insufficiency, and that number may be even higher among people over 40. Many associate this deficiency only with vegans or vegetarians, and it's true that vitamin B12 is found in animal-based foods like meat, eggs, dairy, and fish. But here's the shocker. Even those who eat these foods regularly can have dangerously low B12 levels. That's exactly what happened to James, a 62-year-old man who always ate a balanced diet. He started feeling an odd weakness in his legs, especially when climbing stairs. He thought it was due to a lack of exercise or just getting older. After much persistence, he got tested, and the result was surprising. His B12 levels were below 300. What stood out most was that his test results were marked as within reference range. But as you'll see, those reference ranges can be misleading. Vitamin B12 is critical for producing red blood cells. Without it, your body can't make healthy red blood cells, which can lead to a type of anemia called megaloblastic anemia. In this condition, red blood cells are deformed, larger than normal, and carry less oxygen. The result? Constant fatigue, low energy, and feelings of physical and mental weakness. If you check a blood test, you'll often see an elevated MCV, mean corpuscular volume. And it's not just about blood. This deficiency directly impacts the nervous system. Vitamin B12 is essential for producing the myelin sheath, which protects nerves. Without this protection, nerve signals don't travel properly. This explains symptoms like muscle cramps, tingling, numbness in the extremities, and even muscle weakness. Sound familiar? Another case that caught our attention was Emily, a 54-year-old woman. She started noticing she was forgetting simple things, names, appointments, even recent conversations. At first, she blamed stress, but it got worse. Her focus vanished. When she sought help, the result was, again, low vitamin B12, even though she ate meat almost daily. Now imagine how many people are going through this right now, dismissing it as fatigue or aging while their body is crying for help. Few people realize, but one of the most common causes of memory loss in adults isn't tied to aging itself. It's linked to vitamin B12 deficiency. And the scariest part is that it creeps in slowly, without fanfare. First, you forget where you parked your car. Then, you can't recall the name of someone you just met. Next, you lose your train of thought mid-conversation or struggle to focus on a simple book. Before you know it, these memory lapses become routine. This deficiency directly affects the central nervous system, impairing the formation of the myelin sheath around neurons. Without this protection, the brain's electrical signals don't travel correctly, disrupting communication between areas responsible for memory, attention, and even emotions. And this leads to one of the most concerning issues: early cognitive decline. Studies have shown a direct link between low B12 levels and an increased risk of conditions like dementia and Alzheimer's. This doesn't mean everyone with low B12 will develop these diseases, but the deficiency can accelerate or worsen neurological processes already underway. Beyond that, vitamin B12 is deeply tied to the production of neurotransmitters like serotonin, dopamine, and norepinephrine, which regulate mood. When levels are low, you might feel sadder, less motivated, irritable, or anxious. In severe cases, this can progress to deep depression or even panic disorder. Many people seek psychological help, start expensive antidepressants, or try therapy, but see no significant improvement. And often, the root cause is a simple B12 deficiency, one that's rarely checked early on. Emily, whom we mentioned earlier, also experienced persistent sadness. She felt dull, as if life had lost its color. Everything felt harder. Getting out of bed, making decisions, even talking with friends. Proper B12 supplementation, guided by her doctor, didn't solve everything overnight, but within weeks, she felt a clear relief, like a cloud lifting from her mind. And there are even more extreme cases. A study published in the Journal of Clinical Psychiatry showed that patients with psychotic episodes and severe B12 deficiency saw significant symptom improvement after B12 supplementation. In other words, a single nutrient can make the difference between emotional stability and mental collapse. Here's an important warning. Many people get a blood test, see their B12 is within reference range, and assume everything's fine. But lab reference ranges aren't always ideal. Typically, normal levels range from 200 to 800 picograms per milliliter. However, for neurological and emotional health, many experts suggest levels below 550 picograms per milliliter warrant attention, especially in people over 40. I've often seen patients with levels between 300 and 450 picograms per milliliter, 500 picograms per milliliter, showing clear symptoms, even if their lab report says normal. Correctly interpreting these values depends on clinical context, age, and symptoms. Unfortunately, not all healthcare providers dive this deep. That's why it's critical to also check folate levels when testing B12. Folate, or vitamin B9, works alongside B12 in red blood cell formation and neurological protection. When both are low, the effects are amplified, causing everything from muscle weakness to severe mood changes. Another key point, you should retest B12 levels at least twice a year. This helps catch early drops and adjust supplementation before symptoms worsen. Now you're probably wondering, why do so many people have B12 deficiency even if they eat meat? The answer lies in absorption. People with chronic gastritis, gut issues, long-term use of certain medications, like omeprazole or metformin, or those who've had bariatric surgery struggle to absorb B12 from food. Without proper absorption, it doesn't matter how much you eat, your body simply doesn't use it. Even healthy people like James thought they were safe because they ate meat regularly. But his gut wasn't absorbing it properly, which was only discovered after deeper investigation. After understanding the symptoms and dangers of B12 deficiency, we come to the most practical part, and where many people go wrong: supplementation. Because it's not enough to know you're deficient and grab any pharmacy supplement thinking it'll fix everything. Most multivitamins, for example, contain tiny doses of B12 and worse, forms that are poorly absorbed. The truth is, B12 absorption depends on several factors. After age 40, the body naturally becomes less efficient at this process. Stomach acid production decreases, which impairs the release of intrinsic factor, a protein crucial for absorbing B12 in the small intestine. Without this factor, the vitamin passes through and is eliminated. That's why, even with a diet rich in meat, eggs, and dairy, many people still develop deficiencies. And here's a common mistake: buying a multivitamin, expecting it to solve everything. When you check the label, the B12 dose is often just 5 micrograms, 10 micrograms, or maybe 50 micrograms. That's practically useless for someone with low levels or aiming for effective supplementation. For mild deficiencies, most studies recommend a daily dose of 200 micrograms, but some people need much more, 1,000 micrograms or even 1,500 micrograms daily, depending on the deficiency's severity, absorption capacity, and the form of B12 used. The most recommended form today, with the best bioavailability, is methylcobalamin. It's the active form of B12, ready for the body to use. Another good option is adenosylcobalamin, but the most common in cheap supplements is cyanocobalamin, which is more stable but needs to be converted in the liver before it works, and that conversion isn't always efficient. This is why Emily, after her diagnosis, started using a sublingual methylcobalamin supplement with 1,000 micrograms per dose. She felt results in less than a month, better focus, more energy, and emotional stability. James, who had more physical symptoms like weakness and cramps, began using a liquid B12 solution in drops, taking 20 drops daily, equivalent to 200 micrograms. This formula, which uses nanotechnology and is combined with vitamin E for greater stability, showed excellent absorption. Another detail many overlook is the need for follow-up. Supplementation isn't forever at the same intensity. Those supplementing should retest every 4 to 6 months. If levels are above 1,000 or 1,200 picograms per milliliter, you may reduce the dose or pause temporarily, but this should always be done with professional guidance. Never start on your own thinking more is better. Excess can also cause imbalances. And don't forget folate. This vitamin, also known as B9, works with B12 and enhances its effects. Folate deficiency alone can cause anemia and harm neurological health. So when getting tested, always check both B12 and folate. Another common mistake is relying solely on food. While B12 is found in meat, fish, eggs, and dairy, the concentration isn't always enough to maintain optimal levels, especially with soils increasingly depleted of nutrients and intensive food production methods. Plus, cooking at high temperatures reduces B12's bioavailability. In short, relying only on diet can be risky. And as you've seen, the symptoms are far from mild. The good news is that with proper guidance and effective supplementation, most symptoms can completely resolve. Depression, memory loss, tingling, extreme fatigue, all can be reversed or at least managed with the right treatment. Unfortunately, there's still a lot of misinformation on this topic. Many people suffer for years, treating anxiety, taking antidepressants, or searching for answers to their declining mental performance without ever checking their B12 levels. That's why this knowledge needs to reach more people. Share your experience with B12 supplementation in the comments. Do you know someone with these symptoms? Share this video with them. It could help them regain their health. And if this content helped you, like, share, subscribe, and turn on notifications so you don't miss our next videos. See you next time.